Maureen, for this opportunity to be standing here in front of all of you. And I hope you guys are having a great time here in Boracay. And disclaimer, this is actually a sponsored lecture of Organic Inc. Okay, so I will be sharing with you insights on the integrative medicine in aesthetic practice. Okay, so first I would want to correlate integrative medicine to aesthetic medicine. And we discussed with you also how the aging process takes place, its process, and the key role in its pathogenesis, which is oxidative stress. And then, of course, the approach to the holistic management. So when we say integrative aesthetics, so it describes the emerging trend to individualized, multidisciplinary approaches to care being embraced by practitioners. So for decades, aesthetic medicine has long been standing alone. Okay, so there were a lot of superficial treatments. When I say superficial, it was focused mainly on the aesthetic purpose, on the purpose of improving our aesthetic patients. However, as years went by, there was a need for methodologies to check on the inner health status of integrative aesthetic medicine acknowledges the importance of internal health in achieving optimal results. Okay, so here we can promote the long-term well-being of individuals to boost the self-confidence and improve mental well-being. So, and I would want to emphasize the importance here of preventive care to come up with a healthy aging process. So when we say aging, so it simply means it's a process of becoming older. So whether it's being thought of at the physical level or at the cellular level. So when we talk about aesthetics, aging, on the side of aesthetics, so there are three aesthetic ways by which our skin can age. So we have the thinning of the skin. So we all know that as we age, okay, so almost all cells atrophy. So there's a decrease in the cell size. And then so there's sagging and wrinkling. It's because of the decrease in the synthesis of the supporting substances underneath the skin. And also the protein molecules that are in between the muscle fibers. Also underneath would be the bone tissue. The bone cells there, the osteocytes also will begin to atrophy. Okay, so you see there that there will be thinning of the whole structure when we pertain to the facial features. Okay, when we talk about signs of aging on the face. Because of that, okay, because of the thinning of the skin, there will be appearance of age spots and blood vessels. And since I mentioned a while ago that there is a decrease in the synthesis of different proteins, and that includes hyaluronic acid, there will be areas of dryness already. You have to understand that hyaluronic acid is the water content of the skin. Okay, so when we're younger, we will notice that the skin will be plump, okay, well hydrated, and very tight. So all of these will be declining as we age. And the onset of aging depends on the individual's activities, though there will also be genetic predisposition. So we see here that aging is inevitable. And according to studies, 90% of skin aging can be attributed to UV exposure. So when we say inevitable, so we cannot prevent that from happening, but at least we can delay it. Okay, and how can this be possible? You have to understand that this is beyond vanity. So we need to do some preventive measures. Okay, so aging is a normal, inevitable, irreversible, progressive process, and it involves complex molecular and cellular changes driven by internal and external factors. And it's oxidative stress that plays a key role in the pathophysiology of aging. Okay, so actually this term is simple yet crucial in understanding your body's balance between the creation and neutralization of free radicals. So this takes place, oxidative stress takes place when there is imbalance between pro-oxidants and antioxidants. When we were born, we already had antioxidants in the body. Okay, but however, due to the different metabolic processes, and since pro-oxidants are actually byproducts of these processes that take place in our body, we expect the levels of pro-oxidants to be rising. Though antioxidants can be produced in vivo, meaning our body synthesizes that, if there will be higher exposure to pro-oxidants, there will be disequilibrium, there will be imbalance, leading to oxidative stress. Okay, so you can see here in the illustration, if you have a normal cell here, and then they will be attacked by free radicals. So free radicals, these are the ROS, or the reactive oxygen species. And then that will lead to oxidative stress, which will further lead to oxidative damage that can affect the proteins, lipids, and DNA within the cell. So all of this happen intracellularly. And this is a state, the oxidative stress is a state that has been linked to a myriad of health issues, from aging and chronic diseases to inflammation and cellular damage. So what happens intracellularly is that first, there will be mitochondrial dysfunction. And then, so there will be loss in the ATP production. When we all know that all the processes, cellular processes in the body, in our body, entails a lot of energy requirement. Okay? And then, there's also DNA damage and telomere shortening and lipid peroxidation. So, these physiological changes in cells contribute to a variety of aging-related diseases. So, to name a few, we have retinal disease, neurodegenerative disease, osteoarthritis, cardiovascular diseases, cancer, and some reproductive problems. Okay, so that's why when we try to manage our patients, we will have to it's necessary that we identify the triggers of oxidative stress. Okay, so we can direct our management towards the culprit. But when we say management, okay, on top of the line, it has to be the prevention side. Okay, so we should be proactive and reactive at the same time. Okay, so proactive reactive first. Reactive because we will have to manage our patients. But proactive because when we have identified the triggers of their oxidative stress, okay, and so we have identified that, and we will try to manage that. So that's being reactive. However, in the same manner that we have identified that and educate our patients to avoid such triggers, that's being proactive, and that's the key to integrative medicine. Okay, so and here, so we can see how important the antioxidants are in battling the oxidative stress. Okay, so the antioxidants have a lot of sources. Okay, so there we have the flavonoids, exemplified by the pro-anthocyanidins. Okay, so a while ago, there was a presentation, a short information about the acai berry, and the acai berry, just like any other berries, are rich in anthocyanidin. Okay, so this is actually a compound that is present in the berries. So the darker the color of the berries is, the higher levels of anthocyanidin, which is really a good antioxidant. He mentioned also about the ORAC value, or the oxygen radical absorbance capacity. So this is the unit that is used to measure the level of antioxidants of different say fruits, vegetables that are these are actually being measured, and like what he mentioned, so there's a list released by the US FDA. So and I'm happy to have been partnered with the organic for the past 10 years. And so just to give you an example, if 100 grams of, say for example, kiwi, so it varies. In other literature, they would say that it would be around 800 to 1,000 plus units of ORAC, or ORAC value. So for the organic, for the acai berry, 100 grams of that can be around 102,000. Okay, so what's the difference? Okay, so I mean, so it's good to be checking our what we serve on the plate. It's good, especially when we serve to our family. We need to check what we offer them in the table. Okay, so because you know, especially nowadays that most foods are highly processed, we need a lot of antioxidants to battle oxidative stress in our system. Another examples of antioxidants would be polyphenols like resveratrol, some vitamins. So we have the antioxidant vitamins, vitamins A, C, and E. We also have physanutin or ubiquinol. And then the antioxidant peptides exemplified by glutathione. And some minerals in trace amounts like selenium, silicon, and zinc. Okay, so the people integrating the importance of preventive care in integrative aesthetic medicine. So we need to subject to advise our patients to adopt a healthy lifestyle. So this includes a balanced diet because we know that increased fats, particularly the saturated and trans fat, as well as increased sugar, increased salt, can actually increase the levels of ROS or reactive oxygen species. We should also advise them adequate hydration of at least 3 liters a day, then proper physical exercise. Okay, so we know that exercise can increase the effectivity of antioxidant system. We should also promote having continuous uninterrupted sleep. Okay, so I always mention this to my patients, particularly the lower bracket, because we know that our pineal gland, which synthesizes melatonin, okay, is very higher at its peak when we were younger. But as we age, okay, the synthesis rate goes down. And now that we have been using gadgets, the blue light that has been emitted by these gadgets inhibit the function of pineal gland. So I tell them, okay, so at least 1 hour before your target onset of sleep, you need to avoid your gadgets already. Okay, and apart from that, we can also recommend some melatonin supplementation. So it's beyond sleep. Melatonin is beyond its function is beyond sleep, provision or deep sleep. It's a good immunomodulator. Okay, so and then stress management and avoidance of harmful habits like smoking and excessive alcohol intake. Okay, and it's also good to be checking on the levels of hormones of our patients. So we can subject them to bioidentical hormone replacement therapy. Okay, so now if I could just share, for the past 2 decades, I've actually been a dermatologist. So and please, thank you for that I was able to establish my practice in aesthetics. But just the reason why I got into this field, which is integrative medicine, is that 7 years back I followed a diagnosis of lung cancer, and wasn't a good candidate for neither for chemotherapy nor surgery nor radiation therapy. And if you go for chemotherapy, you might make it to 1 year. However, as a doctor, of course, I wanted to still fight his battle. Okay, that's why after being so hard, we got into this field in integrative medicine that was in 2017. So my better half, Dr. Aline here, he joined me and attended several trainings just to, be with my father. Okay, and then, good thing that he did well as years passed by, and then that CT scan actually revealed decrease in the amount of his cancer cells in the lungs, and there was no metastasis. And totally also, it was better that in 2020, I was able to meet Dr. Homerly, and he really helped me a lot also. And but my father passed away after 5 years from diagnosis, but not from cancer. Actually, he had an attack after my mom demised after that COVID Delta. Okay, so we were them together. But anyways, I just want to share with you that being in this field, it has given us more meaning. Okay, and then now we started actually with patients, our patients, and then their relatives in different treatments. But even at the onset of my aesthetic practice, I've always come up with personalized treatment plans. Okay, but now that we have actually integrated medicine rather to aesthetics, so it's even better. Okay, so now here on my side, these are aesthetic procedures. Okay, the facial treatments. Wherein the goal actually would be solely to aesthetically improve or enhance our patients or my patients then. Okay, so looking here, these treatments actually work really fast. So whatever your issue is, you can subject your patients to treatments and you will see results. For example, you have a Botox injection. So Botox, we know that it inhibits contraction. Okay, so the facial muscles, just like the muscles in our body, when they contract, okay, so and that happens regularly to make they look very prominent. Okay, and with Botox, there is inhibition in the release of acetylcholine. Okay, so and which is necessary for the muscle to be able to contract. Okay, so if there is inhibition, there will be no contraction. And we know that the skin will just take the shape of the structures underneath it. Okay, so we will see a more relaxed facial, how do you say that? More relaxed face. Okay, so now, but however, for Botox, it just works for about 3 months for the patients because since they have stronger muscles than we Asians do. Okay, so so for us, sometimes it lasts for about 4 to 6 months. Okay, so you see, the problem was initially for a patient would be that how do I say that? The muscles of facial expression would be so prominent. You have the frown lines there, the finger lines. Okay, however, after Botox injection, you see a more relaxed picture. However, after the efficacy has finished, and then that's it. You would have to ask the patient to come back for another injection. On the other hand, when we do integrative, when our approach would be under integrative medicine, we would want to subject our patients to a longer lasting effect. Okay, so for example, the threads that are being used for lifting, I'm sure you've been seeing this on social media, there's a lot of advertisements. Okay, so for the threads, these are absorbable sutures. Okay, and during the first, say for example, I would want to lift one side of my face. So if I put some sutures here, okay, and then for the first 3 weeks, you expect 30 to 50% of the material to get absorbed. And during this time, the skin will be under proliferative phase of wound healing. So fibroblasts will form new collagen that are all immature type. And then for the next coming months until the second year, you expect that to undergo remodeling phase or maturation phase. So the immature type of collagen will be converted to mature type. So you see here, it's longer lasting. So it's not like you address solution to a particular problem only. You actually prevent further sagging. Okay? And then just ask the patient to come back, see, after a year, even after 2 years. Okay? And then so other examples of the platelet-rich plasma. So platelet-rich plasma, usually they have it has a lot of growth factors. Okay, so that stimulates the formation of new skin cells. You have exosomes also. Okay, so which are membrane-bound extracellular vesicles containing proteins and other supporting structures, okay, and which could actually form intercellular communication. There's also mesotherapy when you compact your own compound and include whatever the patient needs. You can put there like glutathione to lighten the pigmentary changes that come out in aging. You can include the hyaluronic acid to promote hydration of the skin and collagen boosters also. So I think these preventive treatments really work better than the standard aesthetic procedures. Okay, so another example would be dermal fillers. So you might notice that dermal fillers will both fall under both facial aesthetic procedures and preventive treatments because it depends on the materials that are in your filling agent. Okay, so if you have here longer lasting materials, so that's preventive. But here, you can see the picture here, more proximal to me. Here, the patient developed a Michael Jackson pose. So, she came into the clinic for a revision rhinoplasty. However, I declined her. Because, it's during the time that the procedure was done in another clinic, okay, because I saw her, this was a picture when she arrived in the clinic. So, probably, because she didn't know the material that was injected on her, okay, so probably what was injected in her was something that is, how do you see that? That her body tried to reject, okay, or probably as well, because she wasn't even sure if the one who conducted the procedure was a doctor, okay, but she remembered that the practitioner was in white coat, okay? And then, so here, we also do not know that if it's the technique that caused the problem in her, okay? So, in contrary to the other picture there on the other side, okay, so where I use hyaluronic acid to enhance her nose, okay? That's even better, though hyaluronic acid is a short lifespan. It would take, in books, it would say there around 6 to 8 months, but in my experience, it would last for like 2 to 3 years. Depends on the site of injection. Okay, and then, so also, when we talk about aesthetics, you also try to manage weight, and perform some lipolytic procedures. Okay, so I mentioned about mesotherapy a while ago, and then another example would be lipocavitation that uses ultrasonic energy. So ultrasonic energy actually has the ability to make the fat cells vibrate. So it's within around 30 to 40 kilohertz. So enough to be able to penetrate at that layer of fatty tissues. So when these fat cells vibrate, okay, it will cause them to burst. So, aesthetically, you will really see, if you try to measure say for example, the abdomen. You try to treat the abdominal area. So, you will really see, you will appreciate decline in the circumference of the abdomen. Now, but more than that, if we are to talk about the integrative medicine side, which I've noticed, I've seen that in my patients, there's actually a decline in the SGPT, SGOT of our fatty liver patients. Okay, so now this is what I've been doing, and trying to check on the other purpose of the previous aesthetic procedures. This time in cancer, we don't have oral purpose drugs, right? So these drugs have they have papers for certain functions of certain conditions. However, on the other side, you have they inhibit certain pathways of cancer. Okay, so that's it. And I would just like to share that aesthetic medicine was such a fulfilling practice, because